Hi, I'm your host, Marsha Florence for Just Ask. Today we have with us the Barbara Ann Karmanos Cancer Institute. Hurry back and join us. Hi, I'm your host, Marsha Florence for Just Ask. Today we have with us the Barbara Ann Karmanos Cancer Institute, the Breast Health Awareness Program with Susan Weinberg. Hi, Susan.
Hi there, Marsha. How are you?
Glad to have you back.
Thank you.
Thank you. I see you have some volunteers with you, so why don't we get these volunteers introduced first?
Wonderful.
Hi, my name is Shirley Malamud. I'm a 7-year breast cancer survivor, and I've been doing the Breast Health Awareness Program for 5 years. And I've been volunteering for Karmanos approximately 6.5 years.
Okay.
Hi, I'm Linda Barnes. I'm a 5-year breast cancer survivor, and I've been volunteering for the Breast Health Awareness Program for 4 years now.
I'm Cheryl Reed. I'm a 7-year breast cancer survivor. I've been a breast health awareness educator for the past 5 years, and I've been a hazards of tobacco speaker for the last 6 years.
Okay. Now, Susan, I know this is a very special program for you here, and the last time you were here with Prentice Parker and Bernard Causey for the Prostate Project. Mm-hmm. Okay, now the Breast Health Awareness Program, tell us a little bit about it.
The Breast Health Awareness Program has been with the Karmanos Cancer Institute for a number of years. And in the past, we have utilized a number of staff to be presenters, and we realized what we really needed to do was get more volunteers involved, and certainly, if possible, to have breast cancer survivors become speakers, certainly to help dispel the myths that a cancer diagnosis does not always mean a death sentence. And you're going to find out by talking to these ladies today that that's absolutely true, that there is life beyond breast cancer, and having them go out and speak to a group is like nothing you've ever seen. It makes a point, it tugs at the heartstrings, and it gives women more of an empowerment to realize they need to take better care of themselves and their health.
Okay. Okay. Well, Shirley, let's start off with you. So, tell me a little bit about yourself and your involvement with the program. What do you actually do when you go out and speak?
Well, when I go out and speak, generally I go out with a slide projector, with a video, and we present a program to women of all ages, really. We go to their places of employment or to clubs, and we show them the video, which is of breast self-examination, to show how to do it properly. We do have models where they can practice, and then we have a slide program that shows the importance of mammography along with the breast health education and along with the recommendations by Karmanos to do a monthly breast self-examination, to see a health professional once a year for an examination, and to have a mammogram every year after age 40.
So being a volunteer and being a person who is a survivor, did you find it difficult to actually become a volunteer, or were you more willing to become one?
Well, the heart was willing, the knees were shaky, because I've never done any public speaking, and I do it now, and everybody has been wonderfully kind and receptive. I also figure that I may not be good, but the message I'm bringing is so important that I want to get that across to as many people as I can.
Okay, okay. And Linda, how about yourself?
I have been doing this now for 4 years, and am particularly busy around Breast Cancer Awareness Month, which October is, and have gone to a couple of places more than once during the course of the last couple of years. So you get to know the people there, and they've been very receptive, and it's amazing the number of people that you can meet that are still unaware of what's going on and what they need to be aware of to take good care of their health. Prevention is just really the key, and that's what I think is most important, is to get out there soon enough so people get the message and they can take good preventive care.
Okay, now do you feel like you would have been a volunteer earlier, despite your own condition, or did you have to actually be a patient first before you decided to become a volunteer?
I think that, you know, having experienced it myself really made me more aware of the need to be out there to get the message out to people. In particular, people that are younger. I was amazed at the number of people. I felt that it was just people, though it's primarily those over 50, it does hit people that are under 50 as well.
Mm-hmm. Okay. And Cheryl, tell us a little bit about yourself and your involvement.
Well, I got originally involved in volunteering for Karmanos in the Hazards of Tobacco program because the breast health awareness program was still being set up for volunteers. And when I came to Karmanos initially, they wanted us to be survivors for a year before they put us out in front of a group of people to explain how important it was to get early detection, to try and be in the preventative side of it. And having been through a support group where we had a male breast cancer survivor, the need to make men aware is also so important. And even if I'm not doing a program, I'm always talking about the importance of being aware and getting the mammograms and the breast self-exam, just so that you have some clue that if something doesn't look or feel quite right, you need to go see your doctor.
Mm-hmm. Okay. Now, Susan, do a person or a woman especially have to have a history of cancer in the family or something before she may feel like I better go check myself out? Or, you know, how does one decide, basically?
Well, I'm going to turn this over to our volunteers. I know the answer, but because they become expert presenters, that is a major question. Do you have to have a family history, ladies, to be at a risk for breast cancer?
Not at all.
Okay.
Actually, 80% of all breast cancers, there is no family history. So if you think that you're free because there's no family history, you're mistaken.
Right. So you can actually be the first one within the family
Yes.
to have it. And when you think, oh, well, mom didn't have it, grandma didn't have it, so chances are I don't have it. Okay. So when you find out that you do have it, are you more inclined to prepare your siblings or your own children, your own daughters or whatever, and, you know, to start to have a self-exam themselves?
Yes, indeed. You become, I guess the word would be a crusader, really, because you want everybody to be aware of it. I lost my younger sister to breast cancer, and because of her and because of me, and also I have an aunt who's a 43-year survivor of breast cancer. So for all of us, I'm doing this, and I just really want to get this message out to as many people as I possibly can, because it is so important.
Okay. Does it change your family lifestyle or your family values or anything?
To me, it's made every day really a lot more important than it used to be. And the things that used to be important aren't so important anymore. It really helps put things in perspective and reprioritize those things that have really a lot of meaning in life.
Okay. Okay. What about your children? Well, how do you approach your children or your spouses with the fact that not only are you a breast cancer survivor, but you want to be a volunteer, and that is a crusade. So, you know, how do they accept, or do they accept?
They do.
They do.
They do. I have two sons who were very young when I was diagnosed. And of course, their only awareness of cancer was death. Mm-hmm. And my youngest son, who was 11 at the time, was very, very frightened. He sat and cried almost as hard as I did. And we said, I'm not going anywhere. I'm going to beat this, and we're going to go on. And it does change your outlook on a lot of things, and it makes you reach further and harder to reach the dreams that you have for your future. And of many of the people I know, they look at me and they say, you've got this lofty plan, is this really going to happen? And I said, absolutely. We have a day and a date that we go on with our future out of the state of Michigan. I will continue to volunteer once I get settled in my new home, but it's important. And even though I only have two boys, I think it's very important that they stay up and aware of these things, whether it's prostate or breast cancer or any of them, that they be aware that there is that possibility that they too can have it whatever disease it is.
So you've educated your two sons more likely to understand.
Absolutely.
Okay, okay.
I have 3 children. I've got 2 daughters and a son, and they're all very adult. My daughters and my son all are very, very aware of the breast cancer issue. My husband certainly is. He's been a designated driver for some of my talks because they've been places I've never been before.
Okay.
And my son lives in California, and he's actually had people from his office call me for support when they've been diagnosed. And so I have long distance support groups too, you might say.
Okay, that sounds good. Okay, now let me ask you ladies, now in being a volunteer, are you willing to travel and, you know, take the distance and go places? Do you talk to people on the phone day or night about, you know, breast awareness, health awareness or anything? Do you just pick this up? If someone calls and says, I need someone to talk to and I do have cancer, do you actually just sit down and make yourself comfortable and talk to the person, or what do you do?
Absolutely.
Yes.
Okay, so your doors are always open. Okay, and when you go out and speak, it could be anytime?
Yes. Actually, yesterday I was speaking to a group in New Hudson, and I'd never been to New Hudson before that I was aware of.
Okay.
But it was a wonderful group of women. Every woman there was interested, very aware, and very caring about it. And I felt that, you know, they had learned something, and I had certainly learned from them.
Okay, okay. That sounds really nice. Now, being a volunteer, it means a lot. And that's a volunteer in anything, but this more so. Did all of you participate in the walk? Was it a walk for the October breast awareness program? Did you have a walk this year?
My husband and I participated in Race for the Cure, which
Okay.
is in the spring, and also in the Andrea McClure Cantor for Cancer in June. We were out of town at the time of the walk in October.
Okay. Okay, well, that's fine. Well, ladies, let's take a commercial break, and when we get back, we're going to ask some questions about some of the brochures and pamphlets you have here. Be right back.
Every day, hundreds of people are diagnosed with a leukemia-related illness. Until there's a cure, Children's Leukemia Foundation offers families free support, information, and financial assistance. Families with an adult or child who has leukemia, lymphoma, or a related disorder are urged to call Children's Leukemia Foundation of Michigan today. For free information or to make a donation to Children's Leukemia Foundation, call now 1-800-825-2536.
Hi, I'm your host, Marcia Florence for Just Ask, and welcome back to the second half of the show. And we're with Susan Weinberg from the Karmanos Cancer Institute on breast health awareness. Now, Susan, for this second half, we have an easel.
Right.
And on the easel, we have some important information. So I want to read that out loud and let you ladies take turns in answering this. So the first one is most common risk factors for breast cancer. Being a woman and growing old. Where does that come in at? Okay.
Well, the older you become, the higher your risk of getting breast cancer. At the early ages, it might be 1 in 2,500, and as you progress to being older, your risk becomes greater and greater, either due to environment or to hormones, or they're not really sure quite what all, but enough.
Okay. So if it says 80% of the women over 50, that's not necessarily true then, right? 80%
Well,
of women?
as both men and women get older, Marcia, we become at a higher risk for certain types of cancers.
Okay.
And from the age of 50 on, women become at a much higher risk for being diagnosed with breast cancer.
Okay.
So that's why 80%, right?
Okay. But the actual mammogram should be taken at what age properly?
Beginning at the age of 40, a
Okay.
woman should have an annual mammogram.
Okay.
Now, if she's at a higher risk because her mother, her sister, grandmother has had breast cancer, her doctor may want her to start having mammograms prior to 40. Now, technically, it should be done 10 years prior to the age where her mother was diagnosed. with a breast cancer. But every woman needs to talk to her doctor and talk to them about what they think about when they should have a mammogram. But the recommendations from Karmanos are beginning at the age of 40.
Okay, now before we go to the next question on the EASL, can men get breast cancer?
Ladies?
Yes, yes.
Okay, okay, and you know, how is that, what does a man know, or how does it find out that a man has breast cancer? Does anyone know?
Well, if that's the hard part. Most men aren't given a breast exam like the women are, and they really have to, if there's a risk factor, particularly in their family, they need to talk to their doctor and say, hey, you know, I mean, I realize it's rare in men, but let's check it out. I was in a support group that we had a male breast cancer survivor, and he was actually talking to his daughter about breast self-exam, and he was demonstrating on himself and found his own lump.
Okay, okay, now that's different. That's really different. I'm sure our audience will be stunned at the fact that men can get breast cancer, but cancer doesn't have a name. It just does what it wants to do,
That's right.
any part of the body when it's ready. Okay, now the second half is identify breast cancer risk factors. Family history of breast cancer, having had breast cancer before, having first child after age 30, starting menstruation before age 12, and starting menopause after age 50. Now, I want to pinpoint the one having first child after age 30. Now, what type of cancer, or more or less, would that be, you know, at risk for breast cancer, or would that be more like cancer in the uterus or something like that?
Ladies, anyone?
The last three are actually hormonally linked.
Okay.
And that is why they're all factors, because of the increased hormone activity.
Okay. So starting menopause after age 50?
Yes, and starting your menstruation periods before age 12.
It's a longer period of time from when you first start your period to when you end it. Therefore, you're producing more estrogen.
Okay. Now that's different. I mean, I would have never have gotten, you know, put those two together.
Yep.
Okay. Okay, now on the third one, Karmanos Cancer Institute breast cancer screening recommendations. Starting at age 40, have a mammogram every year. Okay. So at first now you're saying have one if you have a family history of it before 40. Is that correct?
If the doctor recommends you
If-
begin mammograms prior to the age of 40, yes.
Okay.
But all women should look at starting mammograms from the age of 40 on.
Okay. Are women who smoke at more high risk than women who don't?
Yes. Smoking has been linked to numerous cancers. So if
Okay.
anyone smokes, our recommendation from the Karmanos Cancer Institute is stop smoking.
Okay. Okay, now all women should have annual clinical breast exam by a healthcare professional. So are you saying don't go just anywhere and get a breast exam, or what?
Anybody want to address this?
Well, this can be done during an annual physical by your doctor or by a nurse practitioner. And
Okay.
that would go along with the other health issues. You know, have your blood pressure checked and everything like this. This should go right along with it.
Okay, now is there any particular reason why it should be done directly after the menstruation period, or?
For women who are still menstruating, the best time to do that, and also to do the breast self-examination, is about 5 or 7 days after the period, because that is when you are the least swollen and it's much easier to find things there.
Okay.
If a woman is in menopause, beyond menopause, then she should plan on doing a breast self-exam at the same time each month.
Okay, that's good. Okay, now all women should practice monthly breast self-examination, BSEs. So that's what they're called, BSEs.
Yeah.
Okay, so that means that after each menstruation month, you know, a few
Yes.
days after, that's what that's inclined.
Yes.
Yes,
Okay.
the breast self-exam.
Okay, and then if it's menopausal stage, it's still the same procedure?
You do the same procedure, but you would do it at a certain time each month, perhaps the 1st of the month, perhaps the 15th of the month, but the same time every month.
Okay, so what are the two most common risk factors? Anything in particular?
Being a woman and growing older.
Being a woman and growing older, okay. All right, so I'm getting there.
And ignoring birthdays won't help you out. Nobody knows the truth.
I thought it was something else, but I can't help two things. I'm a woman and I am getting older. Okay, now this part right here, ladies, I see that you have like the self-exam. And this part right here is what most physicians give out, or is this something that you give out during your speaking engagements?
We give those out as we give our talks, whether
Okay.
it's the slide presentation or the video, which is self-breast exam.
Okay, and this is basically self-explanatory, so a person can actually figure out, you know, what to do for themselves.
And just to mention, Marcia, we not only have these in English, we have them in Spanish and in Arabic. So our shower
okay.
cards and our materials are targeted to different community groups.
Okay. All right. Now, Susan, what is this? A little rubber something, but I'm going to tell the audience that it's Mighty Grip.
Mighty Grip. There, I
Mighty
just put them
Grip.
out on the table there without
Okay.
the little baggie on
Okay,
it.
so-
It's a jar gripper. Everybody loves jar
I
grippers.
kind of gathered that, but you know, it had a
that
little
lid you
shape
can't
to it.
quite
It's kind of hard to say.
Okay.
You know,
okay.
we have these certainly to help people as far as opening jars or keeping things from slipping around or whatever. But it also gives us an opportunity to have the name of the Karmanos Cancer Institute in people's homes and the 1-800
Okay.
Karmanos number, which we want it to be handy.
Okay. Well, this is definitely handy.
And they're
okay.
free.
Okay. Now, I know the audience won't believe this, but ladies, you can have your own emery board with the address on it. So, and I know we can't see that real good, so I'll just read it. Help the Karmanos Cancer Institute nail breast cancer. If you're a woman 40 and over, get an annual mammogram. Call 1-800-KARMANOS for mammogram location. Now, even though I'm doing my nails with this, I can keep up with the phone number. Okay, now that's nice. That's nice. You know, and I see you all have various ways to make sure people keep in contact or have the information implanted in their head, and that is a plus, okay? And this is a lovely, lovely brochure. I don't know which side is the actual front, but
Actually, you have a star in your hands because the lady directly to your left is also on the front cover of that.
And back.
And back.
Oh, okay, okay. Okay, well, actually, I don't want to confuse anybody, but this brochure is just beautiful on both sides with all these beautiful women here and very proud-looking women, too.
Marcia,
All
that-
survivors.
Yep.
Okay.
They're all survivors on the picture, but also that booklet was written with between a 3rd to 5th grade reading level, because some of the materials that are out are very high reading level and can be difficult for different people to read it.
Okay.
So we designed it to make sure that anybody could read it and
Even the
understand.
print is nice. The print is actually nice, so you know you can actually see it. Okay, and you have a lot of good literature on the table here, Susan. So, is there anything in particular you want to tell us?
Absolutely. 2 things. Number 1, if people would like to become a volunteer with the Karmanos Cancer Institute, just as these ladies have, we have a new volunteer opportunities brochure where it will list all kinds of different opportunities that Karmanos has, not just as a speaker, to work or help out in our offices, to do data entry, computer work, anything and everything. If somebody has a desire to do something and we don't have it listed in here, we're not limited to just this book.
Okay.
And what we try to do is connect the person who has an interest to something they're interested in within Karmanos, and we're growing so fast that we need all kinds of help and expertise, and there's a lot of expertise out there, we know that.
Okay.
And the other thing, which I think is important too, we hand out all these materials and our fact sheets in this nifty litter bag, or information bag,
Okay.
I should qualify this. It's not a litter bag, it's an information
Okay.
bag. And it has our 1-800 Karmanos number on it. This is our telephone number that's toll-free, that we encourage people to call if they've got cancer questions, if they need help, if they're a cancer patient or know someone that has cancer, anything like that, want to become a volunteer. If they want to know if we have support groups, just like our ladies over here have been talking about, Karmanos has support groups for every conceivable type of cancer. And not only support groups for cancer patients, Marcia, but for people who don't have cancer.
Okay.
If we deal with kids, for example, in a family where a child's been diagnosed, sometimes the other kids sort of get ignored because of the trauma that's going on.
Right.
We have a support group for the kids.
Okay.
Just as you've been pointing out, and you've been pointing out, cancer doesn't care about the age,
Right.
money, no matter what it is, and we try to be there for people to help them out.
Okay. So it's extended to the family members who do not have cancer as well.
You bet, absolutely.
Okay, and I know that's got to be, you know, a wonderful program because people get mixed communications. You have the person who was already diagnosed already in a world of its own, you know, of mind-boggling decisions. And then you got the family members wondering day by day, you know, is mom going to be all right? How's dad going to do this? You know, and to tie in both groups, it's got to be tough. It's got to be really tough.
It's a great program. We took our kids to it.
Okay.
Did you?
Yeah, that's how we got involved in Karmanos.
Okay. So your whole family is a part of it, and they
Indirectly, they all participate.
Okay. Well, that's a plus. That's a plus. So you can go home and talk about whatever, and everybody has an opinion and a voice and everything. Okay. Okay. Well, ladies, I appreciate you all very much coming out and everything, and I'm glad to know that the volunteers are up and coming, and so they can call this number. Susan, give out the number.
1-800-Karmanos, but the number exchange on there is 1-800-527-6266. Ask them for cancer information, ask them for volunteer opportunity information. If they want a program, that's the number they should call to request a program, and in turn they will be connected to the person that can help them out to schedule for a program.
Okay. Well, our listening and viewing audience will be very pleased to have a chance to hear Shirley, Linda, and Cheryl speak as volunteers, because everybody wants to know, you know, they like to see and hear good information, and I appreciate you ladies coming, and please come back anytime. Okay.
Thank you.
Thank you.
Well, Susan, as usual, you know you're more than welcome to come back and feed us some more
I'll do it.
information from Karmanos.
Thank you.
We enjoy having you again, so please, anytime, give us a call or drop us a line, let us know what's happening.
But
Okay, well, ladies and gentlemen, you all know who I am. I'm your host, Marsha Florence with Just Ask. And as I always say, if you know someone with a disability, don't be afraid to ask. Just ask. I'm your host, Marsha Florence. Thank you.